So again, what we're trying to do is change the way we pay for health care, to change the incentives, to make it easier for people to give the right care at the right time, and for people to only give the necessary care, not unnecessary care, and not to pay people more for unnecessary care. So that makes a lot of sense. Well, then what's an accountable care organization? Why are you talking about global payments? Well, if you have a global payment, an accountable care organization would be that organization that accepts the global payment. Now that's relatively easy for a Park Nicollet system, because Park Nicollet owns the laboratory, owns the doctors, and owns most of the facilities. Mayo Clinic would find this rather easy, I would think, as well. Mayo Clinic has employed doctors. But in lots of parts of Minnesota and in lots of parts of America, there are no integrated delivery systems. The doctor's offices are doctor's offices of 2s and 3s and 5s. The lab is always a separate corporation. Physical therapy is another corporation. The hospital doesn't employ the doctors. So what we're saying is the accountable care organization would have to be the place that accepts the global payment and then divvies the money up between the surgeon, the pathologist, the radiologist, the hospital, the nurse, the respiratory therapy. Well, in Stillwater, Minnesota, there is no such organization. The hospital is one corporation. The doctors are working for themselves. The lab is a separate corporation. So that's what an accountable care organization. So what would it be? It could be a hospital, could be an integrated delivery system, could be lots of group practices that are linked together. You can't just say that immediately American medicine is going to convert to the Cleveland Clinic or Mayo system, that suddenly we're going to have employed physicians all over the country. It's probably not going to happen very quickly. Now, the new law that was passed, most people think it will lead to consolidation of providers. It'll be more and more difficult for small medical groups to survive. Why? Because if you're in a small medical group, how can you, one, hook into an ACO, and how can you, two, have the capital to buy the EMR that you need in order to do all this stuff? So that's why integrated delivery systems seem to be advantaged in this, because they have a lot more access to capital than a small group of providers. Will this make some hospitals not be able to deliver care? Will it make some hospitals go under and close? It might well do that. But that's maybe okay. Maybe we have too many hospitals. Maybe we don't need as many hospitals as we have today. So, you know, as much as we'd like to have this process of healthcare transformation have all winners, it's not going to happen that way. There will be losers and winners. There will be some small practices that will have to close or become part of larger practices. Some hospitals may close. Some hospitals may no longer be able to offer a service that they're not very good at. And I would contend, is that all bad? So what we've done today is tried to talk a little bit about what's going on in healthcare transformation. We tried to remind ourselves that the core process of healthcare is a single individual trying to live their life as best they can. We've learned that health is not just absence of disease. Health is multifactorial. It depends on how many friends you have. It depends on your behavioral choices. It depends on where you live. It depends on whether it's safe to jog where you live. It depends on whether you have sidewalks and bike paths. It's a lot of things besides just absence of disease. And we've also learned that America is kind of at a crossroads, and the system we have now is not sustainable. That we're going to have to decrease per capita cost and increase quality. That Medicare pays for more than half of American medicine, and that Medicare is slated to go bankrupt in 8 years. So what we have now is not sustainable. We have to change. And we've discovered that probably patients are going to have to change, hospitals are going to have to change, health plans are going to have to change, state government's going to have to change, the federal government's going to have to change, and that one way that change might come about is an accountable care organization, which would be the organization that will allow a group of providers to accept a global payment, either an episode of care or a comprehensive payment, that would then change the problem of the incentives. That, as Atal Gawande eloquently wrote about in the New Yorker article, that right now the incentives are that if you do more care, you will get better outcomes, and physicians will make more money, and hospitals will make more money. And one of the problems we have with that, although intuitively we as all patients want more care can be really hurtful to you. More care can harm you. Being in a hospital is not a healthy place to be. But here's the problem. The problem is that most of us think about more is better. We think that a new experiment, a new treatment must be better than the old treatment. It's just not true, and yet intuitively we have a hard time as patients understanding that. So until we get patients to understand that more isn't always better, that the ideal health care would be what Gary and I have had. We've never been in the hospital because of culture, character, and hard work.